is Calliope, and I am going to be administering your treatment today. How are you doing today? I see. Well, I hope that by the time you leave this treatment, you feel even just the littlest bit better, and we'll see what we can do about the pain and dysfunction in your neck region. So I was looking at your file, I was looking at your medical history, and it looks like there are no contraindications to us performing any sort of work with the head, neck, and chest. But I just want to double check. Have you had any new severe headache, dizziness, or any vision issues as of late? Wonderful. So tell me a little bit in your own words what I'm seeing you for. I do have the bit of information from the file that your PCP sent over, but I'd like to hear it from you, what you think is going on. All right, do you mind if I touch you and kind of look around at that? Very good, thank you. So we've been dealing with some neck pain, stiffness in the neck, any restriction in movement? Okay, no restriction, but pain, all right. And what did your PCP think was going on? I see, so probably some muscle tension issues. All right, and what is it that you do for a living? And what kind of hobbies do you have? I see. So more specifically, I'm looking for how one would be arranged posture-wise for doing those sorts of activities. So we get a lot of people in here that work on the computer, that play a lot of video games, work in an office, that have a lot of these symptoms going on. So a couple other questions. Do you have any sort of headaches that come up all the way up into the forehead or even just the back of the head? Okay, more just soreness and tenderness. Good. What about the jaw? Are you experiencing any pain, restriction, any sort of clicking? I see. I'm just going to do a little feel around here. Okay, and up here, along the head. Any of this painful or tender? Okay, that's good. So that tension isn't radiating pain up in here. That's good. So I'd like to do a little bit of an assessment while you are sitting here, but a lot of my work is going to come from you lying down, all right? So I'm going to get a little closer, and I'd like to just assess the cervical spine here. So let's find C1, C2 there. Good. I'm just going to come down here. We're going to palpate the vertebrae first. Good. And I'm just going to feel a little bit along the neck here, along the top of the shoulders, the chest. Alright, so certainly I think what we've got going on here is just from noting your posture as you are, the kind of activities you do, the kind of pain you're presenting with. I think what's happening is we've got a lot of lengthening going on the posterior body and a lot of shortening on the anterior body, which is pretty common. Your muscles will adapt and they will change their shape a little bit, their length, as they need to make sure that they're holding your body structure tightly and they're holding strong. So this isn't unusual by any means, but we can certainly make that a lot better and reduce dysfunction and reduce pain. Right? Good. So I want to do a little passive range of movement with you, just real quick. I'm going to hold your head, and I am going to move you in different directions, and just tell me if you feel any pain, tenderness, or restriction. Right? Let's go ahead and do good. And a little forward here. Right. Now is this? Back. And forth. Good. Back. And forward. Good. Okay. We're going to do some rotation of the head. Two to the side. Side and other side. Excellent. How we doing? Side. Other side. Doing okay. Good. Finally, we're going to do some lateral bending. So we're just going to come side here. Good. And tilt the other way. And tilt to the side. And tilt to the other side. Here we go. One last one. Tilt. And tilt. Alright, so how was all of that? Okay, yeah, that's good to know. So from here, I am going to have you lie down, face up. We're going to do a little more assessment. Definitely want to do some mobilization to start. And I think we're going to get a lot of use out of some myofascial release techniques today. All right? Okay, so if you just want to make yourself comfortable, I'll give you a minute and then we'll start. Good. Just going to pop on my glasses real quick so that I can see everything a little clearer. And we are going to start here. Similarly to what we did with you sitting up, where I am feeling good. And then we're going to do a little of what I mentioned before, that mobilization. So, is any of this painful or tender? Okay. The structure of the body changes greatly in different positions, so we want to make sure that we are assessing everything in at least 2 positions. And especially because when you're lying down, your neck and the rest of your body doesn't have to work at supporting your head. So things change up a little bit. So I am going to be palpating the vertebrae, but I'm also going to be bending your head a little bit. I'm going to assess each one, and you just tell me if you feel any pain or tenderness, and I'm going to be feeling how they move, if there's any restriction, if there's any barrier at all. I am just going to be supporting your head, and I'm going to start at the base of your neck. This is about C6, and I'm just going to very gently bend your head a bit. Good. How is this? Okay, good. And then we're going to come up a little bit, more like C4, C5. And just going to, there, bend you a bit again. How is this? Good. Come back up very slow. Good. And then we'll come at C2, C3, and side bend. Good. How is this? Good. So I'm just going to bend the neck and have my finger here at C6, and we're going to come to the side here. How is this? Good. Come back up. There we go. It's a little stiff there. And C4 and 5 here. Just go ahead and right here. Good. Okay. Bring it back. And then right here. Just bend over here. This is alright. Good, good. So I am just going to bring you back up here, and we are going to do some tissue work now. So we're going to do a lot of myofascial release. We also do quite a few classic massage techniques like effleurage, petrissage, so that we can warm up the tissues. And then our other techniques work a lot better. I'm going to get a little bit of massage medium here. And I'm just going to spread this around. We are primarily going to work sort of this anterior region of the body, at least to start. In subsequent visits, then we can do some different positioning and techniques. But I think to start, we'll go ahead and work with the trapezius, certainly. I want to work with the pectoralis muscles and levator scapulae, certainly the SCM. There we go. Good. And I'm going to use my knuckles as well. So right in here in particular, we're going to go on the posterior neck and work down. And I tend to focus fully on one side and then replicate that on the other. So to start, we'll work with this side here. Good. And then, just to start out, let's go ahead and knuckle down this side. How is this? And we can really get in here with some kneading. Here along the tops of the shoulders. And a bit of a different angle on that. There we go. There is not as much effleurage as there is petrissage. Medical massage obviously has a different goal than relaxation massage, so where effleurage is used for more relaxing and linking together different moves, we are using more petrissage, and effleurage is for us to more get the medium. But we certainly can bring a bit in. If we want to do some traction, for example. The neck. I'm mostly kneading. Good. So I'm going to be working into kneading with the heels of my hands here. Get a little bit of a greater force with a good spread. Both sides here. Okay, and just going to be kneading the shoulders down. Just pressing the shoulders down and coming up and working with the trapezius. So when we have such a big muscle like this, when we're tilting our head down, the tension from that muscle, trying to hold strong and keep the integrity of the body structure, that's going to pull on the back of the head, the base of the head, top of the neck. And then you've got the muscles here that are pulling. Everything's pulling just a little differently than we need it to. I'm not going to say wrong, because there's a reason they're doing that. But we want it to be different. We want it to be more functional. Good. Now I'm going to get a little bit of leverage here. And we're going to do some compression here. With the pectoralis muscles, kneading them with my hands, compressing them down. Good. How's the pressure feeling? Okay, let me know if I need to back off at all. Let me know if it's just a bit too much. While this is supposed to be therapeutic, and there might be some discomfort, we don't want things to be painful. Press. Good. Now I'm just going to press down. Good. Press down. Press down. Good. There. Good. Press down. Press down. Got squeaky shoes today. Thought it would make sense to wear flats today since it's so warm, but they've just been squeaking away all day. Good. Luckily, since I do a lot of table work, it's not usually something that comes up. So this is where we're going to focus primarily on this side to start. So I'm going to press my knuckles into the side of the neck here. And with my other hand, we're going to open up the chest. I'm going to start more on the medial side of the clavicle, and then we're going to work outwards towards the shoulder. So I'm going to have one hand here. That's putting that pressure on the neck, while the other hand here spreads the muscles very slowly, very gently, and we get some length in the area. Just going to let my hand bit by bit slide to the shoulder. Opening this up here. Good. And then I'm going to do this sort of motion. I hear it called a lobster claw because you're doing this sort of motion. We're going to do some lobster claw kneading on the side of the neck towards the shoulder. Get a good amount of lobster claw in. Good. I'm going to bring my hand to your wrist here. We're going to work with the shoulder and the arm. So I'm going to bring some traction to the arm while the other hand kneads this area. And we're gonna do where, if you'll just let me bend the elbow here, I'm gonna hold your wrist, and I'm gonna be spreading the muscles again, or spreading the skin rather, and I'm gonna do some rotation of the arm while I'm doing that. So if we come in here, just as I'm going, I'm also bringing the arm back. And then bring it up and bring it back. Bring it up, bring it back. As I get a little farther out, then it's a little more rapid, this in and out motion. Okay, so one hand spread, the other hand rotates the arm, brings it back. Brings it back, rotates, and gives us these little motions here, in and out. Rotate back, rotate back, in and out, in and out, in and out. Good. Now I am going to use both my hands to compress the tissue here, and we're just going to hold this, and in a moment I'm going to have you do a little something for me, something real easy. But if I could have you with very small movements, very slowly, if I could have you just roll your head back and forth as if you're saying no. There you go. Good. There. And I'm just going to keep up this compression. And you keep up that motion for a little bit. Good. Good. All right. So now we're going to work with the levator scapula. So this is a muscle that is between the SCM, the sternocleidomastoid, and the trapezius. So it's at the side of your neck, and I am going to have one hand on the superior aspect, or the superior angle rather, of the scapula. You can feel it right there. I'm going to use the other hand, and I'm going to work up the levator scap. So I'm going to press in here, and then I'm going to work along the transverse processes of the spine. where I can feel those is where that muscle is. So using my hand, I'm just going to spread that up and work very slowly up to the mastoid process and come back. Work up, up, up. Good. How is this? Good. Now to transition here, I'm going to work with kneading the arm and the shoulder. Keep that all warmed up. And I want to work with the SCM, but this is a strange feeling muscle to work with. It's a little weird because I need to lift the muscle up and then I'm going to be compressing it. So it might be uncomfortable. It shouldn't be painful. But if it feels too weird for you, just let me know. We don't have to do it. So I'll have to get up under the muscle and then just bring in some of that pressure. So some people find it a little too strange feeling. So just let me know. I'm going to use one of my fingers here, and as I said before, I'm just going to push it along the border, and I'm going to let this lift up, and I'm going to take quite a bit of the skin from the neck here. I'm just going to hold it, just like this. So how is that? Not too bad. Okay. I'm going to compress a little. And then just lift the muscle up. Grab onto the skin in another area. I'm just trying to pull and melt some of the tension out of this muscle. It's a very strong muscle. It holds a lot of tension. Now I'm just going to drag my fingers up the SCM all the way to the level of the mastoid process. So just bringing my fingers up. Good, bringing it up. Okay, I'm doing a few more strokes here. And then we're going to work on the other side. So we'll work on opening up the chest and working the levator scap, working the SCM over on this side. Let's take a look over here. So, just going to bring my knuckles here at the side of the neck, and we're going to spread the chest muscles open again, just like that. Good. So one hand up along the side of the neck and the other works the muscles, giving them some length. we'll do our lobster claws here. Get this nice and warmed up. How's the other side feeling? Good. This will give it some time to rest. And I'm going to hold on to your arm here. Bring a little bit of traction in while I knead the shoulder and the arm here. Good. Give this some good work before we do our bit of arm rotation. So this is where I'm going to bend your elbow here. So we've got a 90 degree. I'm going to hold the arm up and with my one hand here, I'm going to be spreading the muscles while my other hand brings the arm down. So we'll get some of this and bring it down. Good. And rotate the arm. Rotate the arm. And then here, go in and out, in and out, in and out a few times. Good. Just like that. Working from the chest to the arm. It's pulling down on the wrist, bringing it back up, coming down, bringing it back up, coming down, and then in, out, in, out. There. Rotate. Back up. Rotate. Bring it back up. Rotate. And in, out. Good. Good. So, put your arm down here. We'll get our bit of compression. Oh, this feels like it's going faster because I'm not explaining as much since we just did that. So I'm doing the actual moves more in the time they should take, rather than slowing them down to explain. So if I could just have you, if you could do the little bit of rolling your head very slowly with a limited range. Good. There we go. There. Feel everything start to unwind. Everything starts to relax. Good. Just keep this compression. You keep up the movement for a little bit longer here. Good. Okay. Now we'll work back in the other levator scapula. So one hand finds the superior angle of the scapula. The other hand works up that muscle. along the transverse processes of the spine, all the way up to the level of the mastoid process. Good. Very slowly here. It's not a very far distance, so we can take our time. Take our time here. Good. And if I could have your arm and your shoulder here, so that we can knead into it. And then we'll come back to the SCM. I know that's your favorite. I like working with the SCM a little more than, say, the scapula, when you have to kind of wing it out and get really into there. Try to dig your fingers into the little muscles under there. This one's a little easier. Alright, so remember that the side of my finger comes and lifts up that muscle. And then the rest of my hand brings skin from the front of the neck here and compresses that down. So is this still comfortable enough? Okay, good. Good. Here, and then I'll just lift off and reposition here. Good. And reposition. We'll do this compression before working the muscle up to the mastoid process. Good. So just going to work my hand up the SCM, just like we did with the levator scap. We are going to do it nice and slow. Really get in there. Good. Okay. There. Now I'd like to do a little bit of bilateral effleurage and petrissage. I'm going to come back in the middle a bit more. We'll get a little more massage medium. Not nearly as much as we did earlier, just a little bit here. And like our opening move here, spreading the medium and getting our petrissage in there. How was this? Good. We're going to do a little bit of some stretching, and then we're going to finish with a cranial hold. So for our stretching, I am going to use my hands here to just very gently pull down on the skin of the chest. So I'm not going to go much farther past the clavicle here. and very gently stretch. And is this comfortable? Good. So we're going to hold this for a few moments. And then I'm going to have you do a little something for me. And we'll help make that massage, or make that stretch rather, a little bit more effective. So, if I could have you tilt your head back just enough that you feel a light stretch in the front of the chest. Good. And now if you could roll your head back and forth with those little shaking head or no movements, just like you did earlier. Very slowly, limited range, just these minute movements. Right. There we go. I love feeling the play of muscles as we introduce movement. The body is absolutely incredible. It's so complex. It's all pulleys and all these sheets of tissue. It's wonderful. Good. Now I'm going to release this very gently, so I'm going to have you bring your head back down. And I'm going to come off here. Good. Now for our cranial hold here, I am going to be putting my fingertips underneath the occiput. I'm going to have a little bit of a curve to them. So it's going to be something like this. And we're going to hold this for a few moments. I've got all 10 fingers that are supporting your head, pressing in, releasing some of that muscle tension there. And how does this feel? Yeah, it's a special sort of feeling to have something other than yourself support your head. It gives this sort of weightlessness feeling. Good. I'm going to keep that hold for a few moments more. And then very slowly, just going to roll my fingers out. Good. So, take your time in getting back up, and I will see you in just a moment. We can talk about how we want to do our treatment schedule, get you set up for next time. All right. That last move was pretty nice, wasn't it? Yes, it is. That seems to be a real favorite, especially for the end, where you kind of have this supported but floating feeling. So from this point forward, we are going to be working little by little and melting down some muscle tension. We will be addressing any dysfunction. We want the muscle fibers on the anterior side to get a little longer and go back to the way they should be. And we want the posterior side to relax. We want those fibers to shorten and go back to what they should be. So I think that for what you've got going on, let's go ahead and start with twice a week that we'll do these treatments, and we'll do this for a few weeks, maybe 4, and kind of reassess how we feel everything's going. If we can come up a bit, or if we want to keep going with 2 times a week. Right? Okay. Any questions at all? Wonderful. So I'd like to thank you so much for coming in for this medical massage treatment. I really hope that we can get you all fixed up and free from pain and muscle tension here soon. I hope you have a whale of a day and a good rest of your night. Thank you.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon.